Welcome, dear viewers, today in our health television. Today we are dedicating ourselves to neural therapy, but we are also opening up biological medicine again with our two doctors, where we really say we're integrating homeopathy, but also acupuncture, and how this leads to key successes in the body and also in self-regulation. You will learn today. Stay tuned. Hello everyone, it's nice that you're here again. Dear Dr. Thomas Rau, Director of the Biomed Sonnenberg.
Health Center.
Health Center? It's unbelievable. So I always get confused, but it is now so well known. And dear Dr. Jürgen Strein, it's great that you're both here because you really, you are the pioneer of holistic medicine, one must clearly say. And Jürgen, you have been working really for over a year in the clinic and are integrating the specialty of neural therapy, which you really implement together into the patients. I would start with you right away. There is the classic neural therapy. What do you do differently? So, what do you add?
Dr. Rau has just had the experience that when he includes homeopathic remedies that are intended to act specifically in a certain tissue area, the effect is further enhanced and even the effect of procaine or lidocaine is already very pronounced when placed correctly. But because we additionally incorporate the homeopathic remedies, it leads to an amplification of the effect and then often also to a somewhat longer effect. So we can observe that.
If I say now, where can I apply this form of therapy? We already had an interview on allergies, type 2 diabetes, and we also want to focus on type 1 diabetes at some point. Can I generally integrate this into every disease pattern?
So we do it this way, and at Thomas's, every patient receives neurotherapy, with me too, especially with those who have been there for several weeks now. It is time limited to achieve a good result. And then because we do neurotherapy daily, ideally over a period of 2 weeks, you can work very well and achieve good results accordingly.
When I've heard you in the interview so far, can I explain it like this? So either I can insert a needle, then I have only the impulse of the needle, or I can take homeopathic remedies, then it just works homeopathically and the neural therapy acts like a translator accelerator by combining it. So I say I add homeopathic remedies to the procaine or add herbal medicine and the point of acupuncture, and then the procaine acts like an accelerator or translator or enhancer. How can I imagine that? Because it seems that through this something excitement to happen through the combination.
Why is a person sick? That is a huge question. And what does the autonomic nervous system have to do with it? People who are sick have a malfunction in their body's regulation system. They either can no longer detoxify sufficiently, or they cannot absorb substances into the body, or the intestine allows toxic things to pass through, and so on. Something is disrupted. The entire fine regulation operates via the autonomic nervous system. This is not brain controlled, it's vegetatively controlled. The autonomic nervous system is present throughout the body, especially in the intestine. Now we get people with some kind of illness. We know they must have a regulation disorder. And that's where we can start. And there are various possibilities.
Stay tuned, dear viewers. But now you will see briefly a trailer, a spot from a very special program which touched me deeply emotionally. And if it touches you just as much and you think you need to see this program, then please go into the description on YouTube and click on the appropriate link. Enjoy.
When the psyche is so strained, then the immune system is also stressed. These children are not immediately terminally ill, but they are likely to be terminally ill in the next 10, 20, 30, 40 years. Research has clearly shown this. Medicine, in connection with parents and with the materialistic approach, will naturally only see the symptom and will remove the symptom. Because parents want a so-called healthy child that has no symptoms. And that's exactly where the codification of the disease comes in. And that's why, for me, a materialistic world is too dangerous.
In the Ayurvedic, the Chinese teaching, in European traditional natural medicine, it's always about improving regulation. Now there is a method that is neural therapy. It is gigantically good. With it you can practically set a stimulus in seconds. But there is also homeopathy, with which you can do that too. There is also acupuncture, with which you can do that too. Yes, why not combine the three methods together? And that is what we did. We set neurotherapeutic stimuli with, now comes a question, with brocaine or with lidocaine, 1% solution, with which you can change the sympathetic nerve. Depending on where you inject, if for example to a control center of the autonomic system, those are the so-called ganglia, if you inject there, then you have a temporary, this can take 1 or 2 days, improvement of this regulation. That's what we do. We inject into certain points using the technique of neural therapy. This is a sophisticated technique according to Huneke. It is also taught also to doctors. There are really very many doctors who already do this. And we additionally use the cardinal acupuncture points and also inject there.
The training for this you also do for therapists and doctors who already have such a neural therapeutic training and now say, I want to integrate the complete spectrum.
Yes, I teach in this complete spectrum. I provide training where I teach, on the one hand, the approach of biological medicine, that is, this whole regulatory way of thinking, but also this injection technique. And for which point do I take which additional homeopathics? That is very individual and constitutionally dependent.
So you really do work with this constitutional analysis?
Absolutely.
So not just simply for type 2 diabetes, just put that into the procaine, but you also look at what issues he brings with him.
Of course, of course. Every human has his constitution, his predisposition for how the metabolism functions. That must be taken into account. But our neurovegetative injection technique, that's its official name, not neural therapy, it's an advancement. Our neurovegetative injection technique is quite constitutionally dependent. That's why it's a bit more complicated, but it also works extremely well.
What kind of time does a therapist or doctor need to invest in training if they say they're really going to do it?
Well, in fact, it's 2 times 3 days or 3 times 2 days. We do it in English and we train biomedicine internationally. That is the academy. We provide the training any alternative practitioner, nurse, health advisor, or of course doctors can participate.
But also in German, right?
In German, yes, of course. German and English. Sorry, that...
Yes, I just thought now you've exhausted the German-speaking Yes, well, okay.
It's so obvious. I forgot. Sorry. No, we do it in German, a rounded training. And I have to say, I keep encountering doctors who have taken the neurotherapy courses and they tell me, oops, those are worlds apart. It works much better. I think you've also recognized that integrating our remedies and acupuncture points leads to truly better results.
Great. So, Jürgen, what I really appreciate about you is that you've really grown up in conventional medicine classically in Germany. You also had the chance to run a private practice and have now been with Thomas at the clinic for over a year. What are the key elements for you where you say, hey, this is essential for the patient? So what also fascinated you, which component you now have at your disposal logically and treat the patients with?
Yes, it's just a great tool. You really have many more possibilities. Neurotherapy, to put it briefly, is limited by the length of the needle. So where the needle can't reach, neurotherapy cannot be performed. But all jokes aside, the possibility of application is really enormous, and we do it in such a way that we look individually at where we can best support. Practically speaking, at the beginning, I always start with the acupuncture points in the abdominal area, simply to support the metabolism. Patients who stay with us for several weeks, because they then follow our recommended diet, have a dietary change, which can be supported so that digestion works better and the metabolism is stimulated just to speed up the process. Yes, and it is also often the case that patients, especially those from abroad who still eat differently, initially complain about digestive issues, and you can very quickly provide relief with the abdominal points in neurotherapy.
I mean, the key problem really is the whole intestinal issue. We are so manipulated, poisoned, whether through drinking, we've had this whole chlorine issue, antibiotics and so on. It's hardly possible anymore in the environment we live in to maintain a functioning, healthy intestinal flora. Or how do you really do it that the patient can sustainably integrate it for themselves?
I have tested the intestinal flora of over 10 patients, most of whom were cancer patients over the years. And we found that, for example, not a single zero cancer patient had a normal, as it should be, intestinal flora. That means the intestinal bacteria were reduced, especially the bacteroids. And those are the ones that stimulate the immune system. They are the ones that detoxify and bind like sponges with the stool. They bind the toxins and are expelled with the stool.
Is that this lactobacillus?
The lactobacillus is one, bifidus is the other, but the bacteroids, those are the most numerous, are missing above all. That is really quite fatal.
Now, we must not mention a word because we don't want to be deleted, right? But there was a special measure in recent years. And I recently saw from a scientist that it was clearly proven that a specific bacterium is really killed off and the immune system virtually no longer functions. So there was probably also a prize, but it was not published. Do you know what I'm talking about?
Exactly, I know what you're talking about. These are very specific anaerobic bacteria that have changed. In the last 3 years, it's difficult to pinpoint exactly. We have been able to detect a fundamental change in the immune system in very, very many people.
Veränderung des Immunsystems bei sehr, sehr vielen Menschen haben wir feststellen können.
We test people when they come, day one, when they come to us, we test the people.
Testen wir die Leute.
And we see a changed gut flora, we see an altered lymphocyte activity, we test the NK, the natural killer cells, the ones you need against cancer cells.
Die natural killer cells, also die man braucht gegen Krebszellen.
We test various things of the immune system and it has simply changed. But now we are moving away a bit from neural therapy.
Yes, I want to regulate the intestine again.
We say yes for a reason. The largest and most important regulatory organ, where the entire vagus, namely the parasympathetic nervous system, is in the small intestine. In the abdomen, we have more nerve cells than in the brain, and we need to regulate them again. I know the word is unspecific, but we need to bring them back to normal functioning. And you can do that with our therapy, with the stimulation of the classical association points, but especially with a change in diet. And you have to be careful there, because parallel to these 3 years, as I said, it was not only the measures, the health policy and other political measures that have changed. No, the average diet of humans has also changed. And today we have much more synthetic or non-natural substances in the food. That has massively changed. For example, in cane sugar, cornstarch and so on, it's everywhere. That changes the small intestinal flora 1-to-1. And so the patient is taken out of regulation and the consequence is then immune disorders. The consequence is, who knows what cancer disorders?
If I now want to say I want to open myself to this form of therapy, is it something that I would have to do permanently? Or do I really get to the specific problem? 1 or 2 sessions and then see what happens.
Of course, it depends on what needs to be treated. Ultimately, we also work not only with neural therapy. We have combined several very good therapies with each other. And indeed, in the case of the intestines, we would, of course, also treat probiotically. We would also use other products that protect the intestines. And in combination with neural therapy, with others as well, for example, infusion therapy, high-dose administration of vitamins, and magnetic field therapy, for example. So we would combine this individually depending on the disease profile. And it is also the case, especially concerning neural therapy, that no neural therapy is the same as another. This is really very individual what we do there. And I always tell my patients, your body dictates the next step. And it's just that you see, you can plan a lot now, but the patient reacts differently, and then you have to react differently in the next session. So we also don't have a set plan, not for the patients either, when it comes to neurotherapy. Instead, we always react spontaneously and tailor to the respective needs during the consultation.
Yes, the beauty is you have an overview of it all, because especially when I now see small intestine topic, it can also just be the tooth that is simply root treated and causing a nice ruckus here. And that is completely ignored. There's no one coming here who gets their colonoscopy somehow connected to a root-treated tooth or whatever else there may be. It could also be something else.
Yes, absolutely. So 70% of all interference fields are in the dental jaw area. That is very important to also assess.
You have, I believe, great successes also with the subject of tinnitus. That is currently ringing as well. So at every corner I hear right now, tinnitus here, tinnitus there. So it seems many people don't want to hear a lot anymore.
I smirk because it seems that people don't want to hear everything anymore. You can see it that way. I see it much more mechanistically, chemically. The tinnitus is an expression of an irritation of the finest nerves. We have two places in humans where we have the most nerve cells. In the macula, in the eye, the fovea, and we have the second most in the inner ear. And there it has so many little nerves and they are so super sensitive that they already react to minor toxic or viral disruptions. And unfortunately, our population is pervaded with viral or other agents. And that is the reason why we have an explosion of macular problems. Any ophthalmologist will say that.
The retinal detachment.
Yes, the retinal detachment. It's quite popular now, I'll say. Yes, but the tinnitus, that's an irritation syndrome, an expression of an irritation to these finest inner ear cells. And we can influence this change of excitability with neurotherapy. We can target the mastoid, the gateway to the ear. The Chinese knew this 3,000 years ago. The gateway to the ear, this point here, with it. You can calm the inner ear. And it's striking how it works. Additionally, we do cervical spine neural therapy, but at the same time, we also use trace elements and vitamins, a stabilization of the inner ear nerve systems.
And anything else for microcirculation? Because that always seems to be a key issue.
Microcirculation is also influenced.
Okay.
What I'm about to say seems completely absurd, but unfortunately, that's how it is. Well, not unfortunately, fortunately. Human microcirculation is connected with the small intestine. Oh, I know, now he's totally crazy. But it really is like that, because the platelets, which significantly regulate these fine circulation possibilities, are mostly located on the inside of the small intestine. And if the small intestine is irritated, the whole army is there, clumps together, gets flushed out, and causes microcirculatory problems. That's why we always treat this as well. And that's why we have such good success. Tinnitus, please come to us.
Great. Nice. Thank you very much for being here today.
Tinnitus is an ideal diagnosis for us.
Yes, exactly. We can then, as you already said, also accompany microcirculation, specifically administer infusions that also improve microcirculation.
And also, many people are tormented with tinnitus, where they say, I've had it for a year, I've had it for 2 years. So that's really something where you say, okay, it goes so fast. So that's really a grateful patient, where you don't have to work around for a long time. Yes, nice. Thank you for being here. And I look forward to further shows with you. And see you soon. Thank you. Dear viewers, yes, now we've done a little roundup about neural therapy and the important factors around it, from homeopathy and acupuncture, which can still be integrated to open up wonderful self-regulation pathways for us. I hope you were able to take something away. Thank you for watching. See you soon. Goodbye.
Thank you for watching QS24, the Swiss Health Television. Please do not forget to subscribe to the channel down here, or to watch all our programs ad-free via Wikisana, or to consume the selection of programs. I wish you all the best until another time. And goodbye, everyone.